I have some grave concerns regarding the implementation of the proposed rule requiring nursing home staffing minimums. Although I have an immense amount of respect for the work of the work HHS is doing under the Biden administration, I must speak out about the rush nature of this proposed rule and the unrealistic labor expectations on nursing homes when there is a massive healthcare workforce shortage throughout the medical field. Like many districts across the country, Alabama's 7th Congressional District has seen its share of healthcare workforce challenges. This is my inspiration for leading the bill H.R. 2389, the Resident Physician Shortage Reduction Act, which would add 14,000 Medicare-funded residency slots, increasing the number of trained doctors to meet growing demand created by workforce shortages. In the fiscal year 2023 Omnibus Government Funding Program package, I was proud to have secured the inclusion of language from this bill that would add 1,000 Medicare-funded graduate medical education residency slots. Though this is good work, it is not nearly enough to address the workforce shortage across the nation. Unlike my GME bill, this proposed rule does not do anything to support nursing home facilities with increasing the wages for its staff, which would help improve retention of healthcare workers in this field. I have grave concerns about this proposed bill, which singles out nursing homes when there is a real shortage of healthcare professionals across the medical field. Hospitals, clinics, rehabilitation facilities, and more are having a hard time recruiting and retaining healthcare workers, leading to long wait times for patients, insufficient care, and negligence. Nowhere is this more evident than in rural and underserved urban communities. Imposing unrealistic workforce requirements during a worker shortage, and given that 80% of the nursing homes today do not meet the proposed rule standard, means that the proposed rule will force some nursing homes to close their doors, thus denying access to health care for vulnerable communities like the ones I serve. It would only exacerbate an already fragile healthcare situation in communities all across this nation, especially rural communities. In a state like Alabama that did not expand Medicaid, we are already seeing rural hospital closures or eliminating critical services like labor and delivery wards. This has caused my constituents to not only have less access to medical care, but in some communities have no access to care and thus having to drive long distances to receive treatment. Mr. Chairman, I'd like to ask for unanimous consent to enter into the record the Kaiser report.
Without objection.
According to the Kaiser Foundation report, fewer than 1 in 5 nursing facilities would be able to meet the required number of hours for nursing and nurse aides. This means about 80% of the facilities would be unprepared to meet this proposed rule. Furthermore, according to the CMS Nursing Home Staffing Study Comprehensive Report, the total cost of additional staffing required to meet the rule would be $1.5 to $6.8 billion. This is far above the $75 million funded by the administration for training and scholarships. Unfunded mandates don't work, and we should be helping the healthcare industry to train more professionals and increase the pipeline and increase the wages of the staffing needs. I am in support of increasing wages for nursing home staff and quality care for seniors that prioritize patient safety and its affordability for families. I respect the work of HHS Secretary Becerra and the Biden administration's desire to do with addressing workforce shortage, but I would like the administration to consider the negative effects and delay this rule until the healthcare workforce shortage crisis rebounds. I believe key stakeholders, such as the Alabama Nursing Home Association, should have been given a real chance to meet with leaders of the administration to outline ways staffing concerns can be addressed and wage concerns in a collaborative way. In fact, it is my understanding that members of the Alabama Nursing Home Association are meeting with the White House this Friday. I hope this meeting is productive and leads to robust solutions that will address all sides of this issue. I want to support a bill that will delay this rule until the workforce shortage rebounds and support increasing wages for nursing home healthcare professionals. Let us all work together to address this very real workforce shortage that we're experiencing across our healthcare system and across this nation. Until then, I will be in favor of this bill.